Welcome to Fertile Minds. I'm Dr. Jamie Friebe, a fertility specialist at Queensland Fertility Group. Today we're talking about sperm health and what you can do to improve it if you're planning to have a baby. Well, sperm health is very important. As I like to say to my own patients, it takes two to tango. There's no point having an egg released from the ovary if the sperm can't get to it. The sperm have a long way to swim from ejaculation up into the fallopian tube to meet the egg. The vagina itself is a very hostile environment, so a lot of sperm gets wiped out the minute it reaches the vagina. So thus you need plenty of sperm, they've got to be able to swim well, and there's got to be plenty of normal sperm. And of course, if that's not the case, if they're lacking in any of those three areas, then fertilization of the egg will be limited or may not even happen. So there's a few particularly nasty things that are going to affect sperm health. Alcohol, smoking, some medications, drugs, illicit drugs particularly, anabolic steroids, marijuana, cocaine, those kinds of things, poor diet, and being overweight and obese. The body will only reproduce if the conditions are optimal. And so if the body is not well from one of those things I've mentioned, then sperm quality and sperm health will be affected. And it's the same for women with egg quality and egg health as well. Sperm health can be improved by removing those noxious stimulus that I've mentioned before. So if you smoke, you need to stop smoking. If you're drinking too much, you need to reduce the drinking down. Ideally, give it up altogether if you can. If you're using illicit drugs, they need to be ceased, because if you don't take those things away, nothing's going to change. With regards to diet and exercise, I don't think it needs to be too complicated or too over the top. I think just healthy eating and some exercise is good. There are some products on the market with regards to men's health vitamins and minerals and those kinds of things. By all means, use those. I'm more of an advocate though for a healthy lifestyle, because I think that's important for the future as well. My advice would be, generally any couple have been trying for 6 months to fall pregnant who haven't fallen pregnant, you need to see your doctor and start some tests up and running. And a sperm test is part of that. The female in the relationship will need some testing to see if she's in fact ovulating and if there's reasons why she might not be ovulating. But I think all men after 6 months of trying without a pregnancy success should be having their sperm tested. Your sperm test will look at a number of factors, and there's a lot of numbers come back to us as doctors, but the main three that we look at are the sperm count, so how much sperm is present in the actual ejaculate that you produce, what's the motility of the sperm like, how well does the sperm swim, and how much of the sperm is swimming well, and that's given to us as a percentage, and then how normal is the sperm. A lot of sperm actually is abnormal, and for most sperm samples there's only about 5 to 6% of sperm which is actually normal. If the sperm is less than 4% normal, that can be an issue as well. So they're the big three parameters that we look at with regards to sperm health. Men have a major role in fertility. When it comes to infertility, 40% female, 40% male, and 20% don't know. So the men are as responsible for infertility as the women. And that can be a bit of a surprise to some men. They think that it's her fault, it's not my fault. Well, men aren't born with a label on their head saying fertile or infertile, so the only way to know is to get checked. Thanks for watching. Don't forget to subscribe for some more fertility insights and advice.